Great. Well, welcome everyone to the second session of the HIMSS Northern California ePatient Summit. I think we're online and live now and everything. So my name is Liz Kearney and our panel today is Actionable Precision Medicine. And I'm hearing a little bit of an echo. So Ashish and Pouria, you might have to mute when I'm speaking. The HIMSS chapter is delighted to bring these virtual sessions to everybody during this time where we're living and working under such unusual circumstances. And I just want to take a moment on that note on behalf of the chapter and our panelists today to acknowledge the many healthcare workers working in response to the pandemic. And of course, HIMSS is a healthcare organization, so we realize that many of our members are involved in the direct response, and if not in patient care, then they're part of the team supporting patient care. So we just want to acknowledge the great work that's being done by many, many healthcare workers right now. So I'm excited to introduce our panelists today who are deeply knowledgeable about using technology and precision medicine. First up is Meena Ramachandran, who is VP of Product and User Experience at Myriad Genetics. And excuse me, just one second, I'm gonna try to share my screen so you guys can see. Oh, I guess I won't be able to share my screen today, but that's all right. We're learning about this new platform. So Meena Ramachandran is VP of Product and User Experience at Myriad Genetics. Thanks, Meena. And for those of you who aren't familiar with Myriad, it is a personalized medicine company offering molecular diagnostics across 6 different medical specialties. And Meena's critical to delivering convenient access to genetic testing because she leads the team at Myriad that designs all of their customer-facing workflow solutions. She's led product teams at other companies like Counsel and Castlight Health, and she started her career in medical devices. So she's certainly committed her career to using technology to provide efficient and high quality healthcare. Ashish Kheterpal, if you could wave, Ashish, is Chief Information Officer at PACT Pharma, a cell therapy company. Ashish has over 25 years of experience in technology operations and strategic leadership roles within life sciences, high tech, and financial services. Prior to joining PACT, Ashish was CIO at Veracyte, which is a genomics diagnostics company that offers precision medicine tools to guide surgical decisions and treatment. And at Veracyte, Ashish has led multiple IT initiatives like the creation of predictive analytics platforms, physician connectivity solutions, and cloud-based pipelines for next-gen sequencing. Ashish has been at other diagnostics companies as well, such as Solera, CareDx, and Insight Genomics. And then we have Pouria Sanae, if you could wave, Pouria, thank you, who is CEO and founder of IXLayer, which is a precision health testing platform. Pouria previously served as Director of Product Management at Yahoo, Flickr, and Helix. He comes from an extensive startup background as a founder of 2 companies in artificial intelligence and data analytics. Over his entire career, he has led the efforts of launching over 30 genetics products and consumer health tests. And as I said, I'm Liz Kearney. I'm founder of Mainstream Genomics, which is a technology service offering screening plans for women planning pregnancy. I also have over 20 years experience in genetics, split between clinical genetic counseling and marketing for lab diagnostics. So I really want to thank today's panelists for sharing your sought after expertise with us today. And we are going to be talking, of course, about the theme from the ePatient Summit, which is old problems, new solutions. And lab testing definitely has, I'm sure we all would agree, has a share of old problems. A recent Consumer Reports article that I was reading talked about things like getting results quickly and having results be clear. And that's certainly something that's true even just of routine lab testing. So Meena, I wonder if you could get us started by talking about some of what those old problems are in laboratory results and how technology is addressing it.
Yeah, absolutely. So I think maybe the first one that you brought up is that idea of clarity in lab reports, really thinking of that as just table stakes. I think something that we need to contend with is the fact that lab reports were traditionally designed for an informed expert, really the provider receiving that result. Technology offers an opportunity to really bridge that knowledge gap and ensure that patients not only get access to that result in a timely fashion, but that it's clear and coupled with dynamic, personalized education information to support understanding of those results. We've heard things like 10 to 25% of results that are abnormal don't reach patients in a timely fashion. And so there's a real opportunity for technology to support providers without adding additional burden to ensure that results get into the hands of patients as quickly as possible. The second one I'll just call out is that lab reports today are really represent a point in time. They're a static piece of paper. What technology offers up is the opportunity for those lab reports to really be dynamically updated based on the latest information. New findings such as variants going from being of uncertain significance to understanding now that they're deleterious, or as we see that clinical guidelines are being updated in terms of how to take action on that information. Both of those are examples where technology affords the opportunity to really stay up to date on, up-to-minute clinical guidance and literature.
Right. Yeah, and you kind of touch on something about precision medicine in particular, that results, as the science changes, sometimes results change. So that's a really good point. Ashish, you're kind of nodding your head. Is there anything you want to add to Meena's points?
Yeah, no, I think I would echo everything. Meena said, but I think just to add that there's also there's a lot of echo here.
It looks like Pouria, might be me. I'll try muting mine.
Okay, so yeah, no, maybe it's something in my mic.
It might be. If you have headphones and you want to go get it, we could go on to our next point, and you can just rejoin us. Sounds good. Pouria, any comments you want to add to Meena's points?
I think that was quite funny. Ashish echoed Meena quite a lot there, but I do agree. I do agree. I mean, one thing that you look at patients today is, getting to understand the result, being more involved. The other thing that you see, if that's not provider, the second solution that patient goes to is Dr. Google, which nobody really likes. So providing that information directly from the healthcare provider or the lab will play a big impact going forward.
Yeah. Great, thank you. And, obviously we want to focus our conversation today on precision medicine, but it seems like we would be ignoring an important opportunity to, talk about what everyone's talking about right now, which is the pandemic. And certainly we'd all know that lab testing and some of the limitations with lab testing have been part of the conversation around COVID-19. And Pouria, we know you have had some really some interesting and very timely experience with the pandemic in particular. So could you share with us some of the ways that technology is improving access to testing during the current pandemic?
Yeah, so first thing first, regarding the COVID, we've been powering different COVID program for health system, for private sector. My hat's off to all of these people that have been involved. I have never seen any health system, health provider move so fast as they are doing now, whether it is out in the field or whether it is getting some of these platforms online. There are like 4 different major challenges. Connectivity is a major problem. Integrating with a lab, to a physician, to sampling collection facilities, to fulfillment of getting the kits to them is a big problem. We're seeing more and more value getting added for at-home care, pre-screening these patients before they come to, checking symptom as they're waiting for the lab result. And then there's another part that's been also on my mind quite a lot lately is addressing patients that are outside of a clinic that still haven't become a patient. This is, I think, the focus going forward. If we're going to get the economy back in line, you need to test the employees, and you need to provide secure working places. So those are 4 points that we've been quite heavily involved, and it's been challenging both in a positive and in a negative way around COVID.
Mm-hmm. Yeah, thanks for sharing that with us. And, turning to precision medicine in particular, maybe Ashish, since you're back, you could start us off, but and thinking about what are some of the challenges that a laboratory
Ashish, I think we lost Liz.
Yeah, looks like it.
Ashish, did you want to add thoughts around sort of just the COVID-19 response and the sort of the role that we're seeing that technology could play to improve some of the lab testing that's been observed?
Yeah, I think some of the themes we were talking about earlier in terms of making testing available more pervasively. Is there still an echo going on?
No, it's great now.
Okay. Yeah, and I think, how do you integrate testing results so that patients can get the right care quickly? I think that's really the key. And I think technology definitely can play a big role in that.
Any thoughts on your end?
Yeah, I think one is just, you had really emphasized the point of connectivity. And I think a big opportunity, reflecting sort of a miss is that, a lot of this data hasn't been fully integrated across different systems. And as an example of that, we're hearing things like turnaround times being 7 to 10 days. And a big piece of that is being able to route samples to where there's processing capacity. And so the opportunity to more effectively operationalize where there's high volume and demand for testing with where there's supply in terms of labs and processing capacity feels like a huge opportunity, not just within single lab offerings, but connecting various private sector and public sector players. I don't know if you've observed any of that, Pouria, is working more effectively as we're seeing some of the impact of delays in testing.
Yeah, what's interesting right now is that, if you go on FDA's website, there is a long list of labs that have got their EUA and can support these tests, but still you hear that patients are not getting tested. And I would say 90% of that is because of connectivity, is because of these labs not being able to reach to those patients that need it, those providers that needs that. We're trying to help there as much as we can. But a lot of it comes back, Ashish, to connectivity of that lab to this individual, not just the lab to the physician and the patient, but maybe getting sample collection kits to those healthcare providers. Things such as pre-screening everybody that comes and lines in these drives through so that, you don't create these long drives. So the connecting all of these pieces has been a big challenge for COVID.
Right. Are you working with supply chain and logistic vendors as well?
Correct, yeah. So we're end-to-end integrated and we can support that as well, yeah.
Great.
Should we continue on the precision medicine a little bit? I think we can talk about COVID. It's been
sure
on everybody's topic, but maybe a little bit of break from COVID wouldn't be bad either.
Certainly. I think Liz was bringing up a really key topic around precision medicine and reporting of lab results. I think she's back.
I am. And yes, that was the question. Is just like, what are some of the challenges specific to precision medicine? We talked about more of the challenges with routine medicine, but from a tech perspective, what are some of the challenges specific to precision medicine on the technology side?
Sure, and I think Meena touched on it earlier. Some of the diagnostic testing that's going on right now is pretty complex and guides clinical therapy decisions. So I think there's more data that needs to be made available to providers so they can guide therapy and manage the patient population. And I think how do you transmit and connect to provider systems directly from some of these testing labs is a key component of making sure that this information becomes sort of clinically actionable and is used in what the purpose is, which is to guide clinical management. So we, for example, some of the work that we have done is develop sort of advanced portals for our physician customers that can be utilized again in a variety of different ways on desktops or using a mobile interface, and that's really helped our physicians' customer base to adopt some of our testing and effectively use it.
Nice. And with regards to getting results to patients and kind of speaking on that frame, it used to be, of course, that all test results went through a clinician, but more and more we're seeing results get delivered to patients. And Meena, maybe you could talk a little bit about some of the ways that patients are accessing lab test results directly.
Yeah, absolutely. And this is a big focus of ours, and where I spend a lot of time is just thinking through how do we get that result to patients' hands, empower them with that information to really inform better decision making with their providers. And so, the first step is just very obviously getting it to something like a patient portal, whether that be something tailored from the lab, as Ashish just described, or something more generalized that's typically integrated with an EMR. But I'd really emphasize it's not just about getting that result to the patient. It's having to set clear expectations in terms of what information is being communicated directly to the patient, what to the provider, what will be communicated between provider and patient to make sure that we're supporting that full context, making sure that's coupled with education and tools to interpret those results. And then I think just acknowledging that the information that we provide can be truly life-changing. That's, I think, the power of our test, but also the enormous responsibility that we bear to deliver these results with sensitivity and with sort of that highest regard for the information that we're providing. And so some of that, it's not appropriate to just send it over the wire and has to be coupled with really high-touch support. And so that's where, connecting with genetic counseling services, and we're even seeing sort of digital versions of that through digital assistants or chatbots offering almost counseling-like experiences are other examples where, technology can unburden the provider, but still ensure that we're getting results to patients in a timely fashion, but really helping them grapple with such complex and potentially sensitive information.
Great points. Kind of combining telehealth, which we talked about in last week's session, with some of the pure technology solutions. And Pouria, do you have anything you want to add to that?
Yeah, I just want to echo everything Meena said. I think you were spot on. The way we look at it is that we divide the experience of the patient in 4 different steps. There is the pre-testing steps and educating them, going through pre-screenings, pre-testing chatbots. There is during the testing phase where they're waiting for the results, where they can get education while they're going through this waiting period. There is post-testing, which is getting the result. And the last one is really support system around the results. It's always easy to get a negative result, but it is very sensitive for those patients that do have to be positive. So we have that sort of in mind too. So yeah, I fully agree with everything you said, Meena.
Great points. Great points. Thank you. And just kind of thinking about, there have been some reports around genetic testing or precision medicine either being underutilized or perhaps tests being ordered incorrectly. And so what are some of the tools that you have seen used to help clinicians at the time of ordering the test? I'll just open that up. I don't know if Meena, you want to address it?
Sure, I'll start. I think, it actually, I would say, is even a step before ordering. The massive amount of complexity associated with just choosing which genetic test to offer. We hear things like 75,000 different genetic tests available, 10 new tests being brought to market every single day. And so there's just extraordinary complexity put in front of a provider to just determine which is the most appropriate test for a given patient. And so a huge opportunity to better inform that decision-making and matching of test to patient. Once you've chosen a test, then the next question, just like Pouria was saying, is figuring out, who is an appropriate patient for that test. And so we've introduced things like identification tools that can assess a patient based on personal and family history factors that can then clearly indicate, based on guidelines to the provider, if this patient really is appropriate for testing. And then the third thing I'll just say, we haven't touched on it yet, is that cost is a big factor with precision medicine. Coverage is really variable and uncertain with our precision medicine tests today. Hopefully that'll change soon. But that creates a lot of anxiety for providers and patients. And so even before that order is placed, there's a real opportunity to provide transparent information to provider and patient to let them know what the cost of the service is going to be. And make tools to get prior auths or whatever the payer demands in place.
Great points. Ashish, you're kind of nodding. Do you want to add anything to that?
No, I think that's kind of well said. I think the payers definitely are trying to manage the utilization of these tests, and hence are creating more sort of workflows or steps along the workflow to get prior auth before they would we can administer a testing service. So I think technology certainly can help in terms of building these tools, building connectivity to payers, getting prior auths in a more automated fashion and scalable fashion that will allow the labs to perform the test in time, not have to wait for these approvals to come through, and get the patient the results and the care that they need in time.
Liz, one thing, if I may add there,
yeah.
The other thing that is really missing is GCs, genetic counselor. There's a lack of genetic counselor. There is a lack of understanding for a physician how to appropriately determine a risk, determine a need, right? There's a lack of that education, and we are trying to solve that with chatbot education for physician, education with clinical stuff, but there is a lack of GCs, and we should also think about technology to empower them to offer their services, maybe in a telehealth service, etc. But I think that's a big problem in the industry as well.
Mm-hmm. Yeah. We have some questions coming in from our audience, and so there's a few actually. One, what advances do you see for the future of clinical decision support or artificial intelligence interfacing with lab results, both directly to patients, but also to providers? So you've touched on that a little bit, but maybe you could expand on it.
Yeah, I think, we utilize being an esoteric lab, for example, Veracyte, and we are performing pretty complex testing, which is developed after a significant amount of research and is utilizing classifiers that are built on complex machine learning models. And I think the sophistication of some of how the diseased population is being separated, and some of the science that goes behind in terms of developing these classifiers is immense. And I think in terms of just providing access back to the providers, I mean, there is the aspect of longitudinal testing, depending on, of course, the test menu, but there's a great need of monitoring the patient post providing the first testing result, and making sure that identifying the right baselines and how the patient's moving in terms of longitudinal testing. So I think providing all of that complex pieces that are moving, and the clinical therapy recommendations are moving with every potential visit, is, I mean, I think technology is what's really enabling all of that.
I'll just add to that I think an essential part of bringing precision medicine into clinical pathways is bringing it to point of care. And so really, where our providers are spending every moment is in their EHR. And so making sure that results ordering or test ordering, test resulting is available through the EHR is critical. But as part of that, as Ashish touched on, the results from these tests are often pretty complex. They convey a lot of risk and are multifactorial. And so a huge opportunity to take advantage of the advances that he described to make that data both more discrete, but also more digestible in the EHR. So it's not just, see attached result as sort of it is today oftentimes, but it's actually bringing in, interpreting that as discrete data that can be used to drive a lot of additional decision making, as mentioned.
Mm-hmm. Pouria, anything you want to add to that?
I think Ashish covered it quite well. And from our point of view, is removing some of that technology burden, empowering these companies with some of these solutions. But I think, Ashish, what you mentioned, exactly the steps that is involved one by one, being able to taken care of by AI will speed up the process and hopefully make that medicine more precise, make the test to provide it to the right person.
Exactly. Yeah.
Yeah. And we do have another question from the audience. I do want to mention to our audience that if you want to interact with us or each other, of course, as some of you already are in the chat room, something we would be curious about as a panel is, as some of you with institutions, what are you finding as some of the challenges in terms of implementing precision medicine or genetic testing through your own institution? And along those lines, we have a question. Do you have any guidance for provider organizations looking to implement clinical workflows and tools that maximize precision medicine on a large scale? Ashish, do you want to touch base on that?
Yeah, I think one thing we kind of touched on as we were responding, some of the things we discussed, I think it was EMR integrations. And I feel like given where we are on the technology curve, healthcare still lacks in terms of adoption of technology. I mean, if you look at the landscape around us, at least the smaller esoteric labs like ours haven't been able to connect to EMRs in a big, pervasive manner. In fact, we've done very select few integrations because of the cost or barriers that exist. And I think companies and organizations like Pouria's can certainly help to make those interfaces and connections possible. But I really see, I think that's something that we as an industry need to focus on because there's still a lot of faxing of patient results or order intake that goes on in a fairly manual paper-based systems. And I think there's definitely big strides that we can make in those areas.
Mm-hmm. Yeah, in our observation, that's really the number one factor, as she said, the sort of EMR integration in terms of being able to standardize this, particularly with large systems, is just bringing it to point of care, making it that easy for providers. to order it like any other lab test in their systems, not necessarily forcing them to go out to another portal in order to take action. I think the other piece of that is just mentioned is then making sure that we're taking advantage of all the other data, the rich data sets that are in that EHR that could help inform, again, which panel selection is appropriate for a given patient. So minimizing some of that decision-making process by bringing all of it, that full workflow, into the EHR environment.
Yeah, that's a definite common complaint from clinicians around so many different portals to keep track of in terms of different laboratories, and it doesn't help them to be able to access it in a timely way, having to keep track of so many different systems.
Yeah, I think that time is an issue, but there's also an issue of transcription of that data from the EMR systems onto a potentially a paper-based requisition form, and there's errors or missing information that then the lab has to collect on the back end. And all of these factors contribute to a delay in testing, and of course, subsequently a delay in patient care. So I think certainly a key focus area for us as an industry to spend time and effort on.
Mm-hmm.
One thing that we see on our end is when a lot of our services, a lot of our daily work is exactly this. But one thing that we see is different between precision medicine and population health, where in the population health, you're looking more from a research point of view, more touch points with the patient. That could be of a great value if you brought that into precision medicine. So that could be if you could bring in what we call real-time data, real-time health data, could improve some of these health results. It could be as simple as things as, is this individual a smoker? What is the life habits of this individual? Which medication does this individual take right now? To more complex things that is based on historical data that might not exist in EHR, but that should be there.
Yeah, thank you. Really great points. And one thing we haven't touched, we've been talking a little bit about how there are tools that can help with clinician interface and patient interfaces. As a technology group, obviously, we also have to think about the technology stack and what that is like in the precision medicine setting, particularly for a laboratory. Ashish, maybe you could start with some of the comments about what the big challenges are, given the level of data and so on in precision medicine.
Yeah, I mean, I think going back to something I said earlier, the development of some of these advanced esoteric tests takes, almost 2 to 3 years time frame in terms of collecting enough clinical samples and data for us to be able to develop a new diagnostic. And of course, the science and the level of classifiers that we are developing certainly is advanced to the point where it's not just a simple algorithm, even just looking at genomic data, but you're now combining clinical attributes, like Pouria was mentioning, smoking history or prior cancer history. And I think combining some of the clinical attributes with the genomic data, and again, are you looking at mutations, are you looking at expression, and then building a advanced classifier that then comes up with a diagnostic. And we had to also pay attention to how that fits into the sort of the clinical care continuum, if you will, because there's a current standard of practice that the physicians are, of course, are as part of their protocol. And how do you introduce a new diagnostic testing service, for example, in that workflow and have that adopted? So I think that's a huge challenge in terms of improving uptake of that product, which involves a lot of education to the providers and making sure that it's providing supplementary information that adds to what their current standard practice is or improves it.
Great points. And Pouria?
I agree with Ashish. I'm going to take a little bit more a technical point of view on this. This is really a new layer on top of the lab. This is far beyond a LIMS system. We're talking about providing a cloud infrastructure or HIPAA cloud, a large data storage. We're talking about quite advanced bioinformatic pipeline, file conversion, FASTQ to VCF, interpretation, annotation, imputation. And then after that, we're talking about connectivity, integration to EHR, integration to third-party services that might be offering, some sort of a content library and interpretation service off there. And then if you want to make it more complicated, you got the regulatory part with GDPR, giving patients access to that data. In Europe, you have to be able to download that data. You have to be able to delete that data if you want to. So that whole list of things is really outside of the capability of some of the traditional labs. It's a new layer on top of the lab, in my belief.
Yeah, no, I think that it's certainly, there's a lot of areas, if you look at sort of the back-end infrastructure that enables this entire sort of testing process. All the way from things like LIMS system and sample accessioning workflows. And the one thing we can't forget is the payment and reimbursement aspect of this, right? So there's the whole complexity around submitting claims to every plethora of payers that exist. How do you have HIPAA EDI transactions to integrate with these payer systems? Again, not only to just submit claims, but also receive prior authorizations in a more automated fashion. And of course, get reimbursement and go through the whole journey of appeals and until you actually get into contract and full coverage with these payers. And of course, there's a lot of technologies that come into play to really bring it all the way, all the way from the clinic to actually providing, testing and then care back to the patient.
Yeah, and for that payers, I think we can have a whole week session on how to tackle that.
That's right.
That's definitely true. Ashish, you brought up the point around there's the genomic data, but then there's all of the other clinical data and how important that integration really is if you're going to have an impact on patient outcomes. So what kind of trends are you seeing in terms of efforts to try and solve that particular type of challenge, that integrating, data from different sources in order to help the patient and guide the clinician?
Yeah, I think, we try to get involved early with some of our KOLs that we are doing some of these studies with. So we have some of these interfaces built early and are acquainted or well acquainted with all the data that can potentially play a role in developing these advanced classifiers. And I think that's a really key, because at the end of the day, you want to have a product that's, again, changing or adding value to the current standard practice and has a good chance of getting adopted and paid for.
Mm-hmm. Other comments from Meena or Pouria?
I'll just add, we've touched on reimbursement a couple times. The value story, as Ashish mentioned, is just critical. And so I think we're all recognizing the need to do large-scale research that supports the economic value of precision medicine. We know it will deliver better, more targeted care, but we need to sort of prove the cost effectiveness of it as well. And that's where some of the longitudinal studies that were mentioned earlier, and coupling that with advanced study design, targeted enrollment, post-test follow-up, collecting outcomes directly from patients, all of those can come together, built on a technology backbone to expedite that data gathering to better support cases that, with additional coverage will ultimately result in greater access, which is really what we're all trying to achieve.
That's a great point about the clinical utility kinds of studies that are needed to build, as you say, the value story. What are some examples of strategies that services are using to provide that value, the value proposition for payers?
I think it's exactly what you just said. Payers expect that there's enough clinical utility data available to them so they can make a positive coverage decision for a test. And again, they're looking at at least 2 to 3 years worth of follow-up since the initial diagnostic that may have been rendered back to the patient. And they want to make sure that there is a positive clinical outcome, and not only it's positive, but it's also sustained for a period of time. So I think they expect that if patients, for example, deemed benign, then they stay benign for a certain period of time, or at least a couple of years. And I think so it's important to not just provide the point-of-care testing, but also continue to collect follow-up data. So you build enough evidence around clinical utility to be able to convince and get reimbursed, and again, improve patient outcomes.
Go ahead.
Yeah, I think it's definitely a challenge. I mean, the value of these tests is in informing decision-making and motivating better choices for patients. And so comparing that to what the baseline choice would have been in the absence of this information, and then, as Ashish said, tracking that journey through, what was the choice that was made, and then as a result of that, what was the improvement in clinical outcome or cost savings realized over time. It does require, large population studies to really draw those conclusions. But just as an example, for some of our carrier screening studies, we're specifically looking, for example, at what decisions parents are making in terms of their pregnancies on the basis of the information that we provide. And that could involve following up with what happens with that family or that child several years after birth. And so, but putting together that picture is really what gives us all confidence in terms of the impact of these tests and that they're really worthwhile.
I think I'd like to pose a question to Pouria, just in terms of as a technology player, where do you see the most opportunity in this space?
I think if you listen to, exactly what you mentioned and exactly what Meena mentioned is around the patient, is providing tools and providing easy access technology for the patient to be able to not just get the result and so on, but follow the patient throughout the journey and far beyond the test, how a lifestyle gets changed. I think right now, even if you look at consumer genomics, you see a huge trend change between, people initially just being genetic tourists, as we call them, to really caring about their health. So now providing tools that follows these patients and the patient sees improvement across time, sees levels lowering because of a change of a habit is the big opportunity. I think that's going to be this next decade's focus. A lot of it has been around EMR, physician, etc. But I think we see a change where patient is in the center of it.
Agreed. Yeah.
Great point. We do have a couple more questions from our audience, and if anyone else has any questions, please use the Ask a Question section of the menu. So we had a point around it's technically very feasible to gather data from multiple sources. So the question is, any comments on the consent of or getting these or EMR vendors allowing to access that data?
Yeah, I think it's technically feasible. I think definitely with I think the technologies around interoperability that exist in terms of REST services or SOAP services or even HL7 based integration, I think the technologies exist where I find we are a little bit behind the curve is in terms of adoption of standards across the industry, right? So you will find different systems have, or could be on different versions of HL7, for example, or may not support REST APIs, integrations. And I think we need to, like I said earlier, as an industry, move forward and to standardize, how do you connect with these systems and exchange data back and forth. And I think there's definitely some room for improvement there.
If I add there, there's one of the issues is connectivity, like Ashish mentioned, HL7 or Fire, and they're not. The other issue is being able to push the data that is indexable in the next system. So some of the challenges is if we push in a lab result in the form of a PDF within an EHR, can the content of that PDF be searchable for a physician, which it can't. So now you need to create subset of indexable data in an EMR or EHR that can be searchable, that can be, as soon as a patient's brought into an emergency room, it pings up. I think that's a big challenge that we're seeing working with some of these healthcare providers right now. So those two are things we need to tackle soon.
Mm-hmm.
Yeah, I think it's almost as a practice, every time we integrated with an external system, we of course send them a PDF version of our patient results, but we also send them discrete elements from within the patient report so they are searchable within the target EMR system. But yeah, that's a good point. Not every EMR system would support both seamlessly. Some may only do one or the other.
Thank you. And we had one last question going back to the discussion of COVID-19. I feel like the current issues with COVID-19 testing process have existed for some time, i.e. pre-analytical, analytical, and post-analytical. Do you think that the current crisis will highlight some of these gaps and perhaps give an impetus to address them on a much broader scale? It's an excellent question. Just the bright shining light being put on lab testing right now. Is there an opportunity to make some broader improvements?
I really hope so. I mean, if this doesn't change things, I don't know what would. So yes, we're very positive that we're tackling some of these issues on a daily basis. Now, I really hope some of these will change and it makes it more streamlined, easier for labs to offer testing across the US. And I want to add one more thing. It's not just the lab, it's that the entire ecosystem is connecting it, is providing the ability. So there are a lot of labs that have their AUAs, they're up and ready to go, and they don't fill their entire capacity right now.
Mm-hmm. Meena, were you going to say something?
Yeah, I think the population health aspect of this is really enormous. I think, all of these labs working in an incredibly fragmented fashion, but sitting on top of extraordinarily rich data that, can inform better mobilization of resources and action, whether on a local or federal scale, is a real opportunity, so for the next, building those systems. So, for the next COVID, we're already able to have that early warning system and can immediately turn on the flow of resources and capital to the places that need it the most.
Thank you. Another question came in. Are there any case studies or examples of innovative companies or customers that any of you would be willing to share?
Across any industry?
Yeah.
he clarified examples of providers, as an example, examples of providers that are working to incorporate precision medicine into their practices.
Yeah, but I think one case that I can talk to it, we did at Veracyte, for example, we're doing a lung cancer diagnostic to look at likelihood of lung cancer and what the risk is post our testing. And one of the key things that we realized early on was that physicians or pulmonologists are doing procedures in a bronch suite. And based on some rapid on-site pathology services that are available to them, they want to be able to quickly make a decision to order the molecular test. So I think providing them, for example, I was referring to earlier, a mobile interface that they can just pull out their phone and be able to order that test without having to go to a desktop and pull up patient record, I think was a great, facilitator, if you will, to allow them to quickly get the test underway.
Nice. Thank you. And we have one last question I think we have time for before signing off. We've seen a lot of investments in femtech in the last few years, specifically around women's health and family planning tools. Do you think that this will influence the future for genetic testing, and if so, how? Meena, maybe you could answer that one first.
Yeah, I think in a huge way. And I think just recognizing and really studying and understanding that persona of women seeking out care for themselves, but then also being sort of the chief health officer for their families as an opportunity to provide these insights. And we know in terms of that profile, oftentimes strong proactivity and taking action on the insights that are shared. And so the more that we can get these different tools and assessments around risk in the hands of women at various stages of their lives, opens the door to these tests that then can provide valuable information to better take care of themselves and their families.
Thanks very much. Yeah, totally agree. There's some opportunity to empower the patients themselves, particularly in women's health. So thank you for that comment and question. So we're probably coming to the end of our session. If our panelists are comfortable, if you want to share your contact information, you can put it into the chat section in case anyone from the audience wants to contact you. But I also just want to thank everyone for joining and plug for a moment the session for next week, which is how advances in nutrition IT break down care silos and improve patient outcomes. And that's featuring Jenny Benfeld, who's founder and CEO of Recast Health and president-elect of Northern California HIMSS, and Margaret Ditloff, who's head of product at Genomics. So hopefully you will all register for next week's session as well. And thank you again for joining, and we hope that you found the session interesting and engaging.
Thank you, everybody.
Thank you.
Thank you.
Bye-bye.
Bye.